You see if this is on. Yes, it is. It's live. So good morning, everyone. Thanks for coming out. I know there were others who wanted to come out, and it's a good thing, Mr. Mayor, we're not grading Metro and water mains this morning. I was glad I left early. Our office is up at Thomas Circle. You couldn't get a cab from there to here, so it was a brisk walk. And I'm glad to be here. So, welcome everyone. DC Appleseed, as I hope most of you know, has been at work in partnership with the city and the nonprofit community for over 10 years now, trying to address the HIV/AIDS epidemic in the city. And when we were first asked to step into this work by the Washington AIDS Partnership, the reason was that the city at that time led the nation in the incidence of new HIV and AIDS cases. And the question was why and what should be done about it. And so DC Appleseed, supported by our pro bono partners at Hogan Lovells and Paul Weiss and many others who have worked with us, undertook to try to answer that question. And once we had what we thought was a good answer to the question, to try to work with the city government and the nonprofit community to implement a number of recommendations to address the situation. And I'm glad to say that I think things are a whole lot better now, 10 years after we began this work. And it isn't so much what DC Appleseed has done, although I think our monitoring role, our incentive-inducing role has been useful. I'll never forget the day that Adrian Fenty was asked, Mr. Mayor, what his HIV/AIDS policy was. And he said it was to make all A's on DC Appleseed's report card. So although no one has ever made all A's and probably never will, the grades over time have gotten better and better and need to get better and better. Because of the severity of the epidemic and what it does to the lives of the people here in the city. So I'm very glad you are here. I'm glad that our partners have been here for so long. The plan here this morning, since I know the mayor has another engagement to celebrate another great thing that the city is doing, the mayor is going to speak first, then I think Dr. Garcia, and then Michael Carfin. And then I'm going to take just a minute to give you some of the highlights of the current report card and to make an announcement about a new report that DC Appleseed plans to undertake. So, Mr. Mayor, if you will come up, it's my pleasure to introduce Mayor Vincent Gray.
Thank you, and good morning, everyone. First of all, I want to thank Walter Smith. He, at one time, not a lot of people remember this, he worked in the Corporation Counsel's office. That was a while ago, wasn't it, Walter? Yeah, and
Progress has been made there, too.
Absolutely. We are happy with the progress we've made in what now is our Attorney General's office. So, thank you for serving in the public sector, and thank you very much for what you've done with Appleseed, having worked to make sure that we continue to pay attention to some of the most important issues in the city, hardly the least of which is the HIV/AIDS epidemic that we've been working on for a very long time. I'm delighted to be here with Dr. Garcia this morning. Last two times before today, I saw Dr. Garcia. He had his uniform on. You know, he's in the public health service, and he's an admiral for those who don't know. I was with him on Friday when he was presented with a flag over the Department of Health and Human Services, and what a wonderful ceremony it was, and what a wonderful statement it was about the capability and commitment of Dr. Joxel Garcia. So, Dr. Garcia, thank you so much for your leadership on the health front generally, and then the HIV/AIDS front in particular. And then Michael Carfin is our senior deputy for HOSTA, and the work that he has done also has really helped to move the ball down the field. And I want to thank all of those who work with you too, Walter, to help make this happen. It's great to see people in the community step up not looking for any pay, but just want to be able to do this civic duty. And the people who work with you are extraordinary citizens, corporate citizens in many instances. So thank you for assembling such a great group of people and getting them involved in some of the most difficult issues that we have here in the city. As you've indicated, it's a decade since the reporting started. And, you know, I guess like anybody, people want to get an A. And I think that's true of so many folks, and certainly true of me. And it isn't just about getting an A, of course. What it's really about is being able to have that as a reflection of improvement in how we are facing this epidemic in the city. The first report that came out was in 2005, I think, and that was not a very good statement about the city's efforts at the time, but we've all worked hard to try to improve that since. I guess even then it was clear we had potential for improvement. It just required a concerted, focused effort, which we have tried to engage in now over these years since. I think this is the 9th report that you've done. We promised, I guess, back in July when we released the data then that we would release more stats. And this is kind of the underpinning of determining whether we're doing better or not. You know, what does the data say? And then how do we interpret that data? But even more importantly, how do we use the data to be able to improve outcomes on this issue? We have continued to see decreases in new cases. We have, I guess, 58% drop in new cases from 2008, from 1,180 cases down to where we are now, which would obviously be more than half of that. There's so many reasons why we've been able to do that, and so much of it emanates from collaboration. I see Don is here this morning, and it's been great to work with the Whitman Walker Clinic. I don't think I've missed one of those events, one of those walks, AIDS walks that you all have conducted, Don, in this past year. And Walt and I were just talking about this, the commitment to end the epidemic. That was the focal point of the walk this past year, and I was delighted once again, one, to be a part of it, secondly, to see so many people who participated in the walk, and everybody kind of focused on maybe the day will come when we don't have to have this walk anymore, because we will have found a solution to this. Again, the report card, which I invite all of you to read, which, again, Walter, I have read. It's a rather thick document, but it's not hard reading. You can kind of get through it pretty quickly. You know, and I look for the good stuff, and then I look for the not-so-good stuff to see where there are improvements that we can make. We've, as you will read in the report, we've made progress in areas of leadership. That's good news, because I know we didn't do as well as we might have done last year, but we focused a lot on that in the months since then, and how we manage our grants, the HIV surveillance, and then the monitoring and evaluation of programs as well. And we maintained an A in the testing, the condom distribution, and I'll talk about the data on condom distribution in just a second, which has really gone up over the years. And then how we serve people who are incarcerated, because we know that that is an arena, unfortunately, where the virus easily can be contracted and spread. The numbers at one point were absolutely unbelievably high in our prison system. You know, our prevalence rate was about 3% at one point, and because I follow this pretty closely, and I really thought it was going to be very difficult to bring that down for a good reason, in a sense, and that is that we've, improved our treatment of the condition, and therefore people are living much longer lives. It's no longer a death sentence, and we have helped people live lives that are of the same longevity as anybody else. So bringing down the prevalence rate becomes more difficult in circumstances like that. But the prevalence rate now has come down from 3 to about 2.5, which is enormous progress as well. Again, you look at what we've done on so many fronts. We've increased the publicly supported tests in the District of Columbia from 43,000 in 2007 to 160,000 in 2013. And the data that formed the basis for this report are 2013 data, right? We don't have the 14 data yet ready to be able to look at. The number of tests, again, as I indicated, gone from 43,000 up to 160,000. Condom distribution has gone from 500,000 in 2007 to 6.9 million at this stage. And that may be one of the most significant statistics that we're able to talk about at this point. The needle exchange program, and many will remember that we were prohibited at one point from having a needle exchange program in the District of Columbia because our overlords, our overseers up the street, had imposed a rider on our budget that stopped us from being able to distribute syringes, despite the fact that there were many cities at the time that had demonstrated the efficacy of having a needle exchange program. Finally, we had a little window of opportunity when there were friends of ours who were running the Congress, and we were able to get that off. And frankly, it has not been reimposed because it's just foolish. I don't know how to put it any other way. It's just foolish not to take advantage of an opportunity to be able to save lives. I think, gentlemen, we're above 80% in terms of the reduction now in the transmission of the virus by virtue of injection drug use. The other areas that are really important to us is getting people into care within the first 3 months. Not so long ago, it was just 57% of the people who were getting into care, and we're now at 84% of those who are getting care in the first 3 months. People who are staying in care, which is hugely important because, again, if you start to take the medication and then you stop, you may be in some instances worse off than if you hadn't started in the first place because of your own reaction to the drugs. We have now increased the number of inmates in our prison system who are being tested to above 6,500, which is a huge increase. It means now that the number of those who are not being tested is down to 6% at this stage, which is a huge increase as well. And we have what's called the no wrong door approach, right? And that is people who may want to come into services in whatever avenue they choose to use to come into services will be an acceptable approach. As Walter said, we'd all like to get an A on everything. But with the rigor I know that Appleseed uses, I don't think we'll ever get an A on everything. And frankly, the A for me is the day comes when we don't need to grade ourselves anymore because we, in fact, will have ended the epidemic. One of the things that I especially am alarmed about is the reporting that says that we need to do a better job with our children. And that's our Office of the State Superintendent for Education that needs to improve its outcomes in terms of educating our children. Again, to help them understand how transmission of the virus can be prevented in the first place, how HIV becomes full-blown AIDS. We've got to do a better job with that. And frankly, I was thinking about this when I was reading the report. We probably need to engage some of the parents more as well in helping them understand how to be a part of the teaching team for our young people, because if they contract it at an early stage, that means they're going to be grappling with it for a very long time until we find a cure. So again, Walter, I want to thank you very much for the work that Appleseed has done, and ask you to continue to do it until the day we can all celebrate that the epidemic is over And that day will come. It won't be tomorrow. It won't be day after tomorrow. Maybe not next week, but maybe next month. Who knows? Thank you very much, Walter.
Okay. Well, good morning, everybody, and thank you, Mayor. And after me is going to come Michael, and he's going to go with some statistics of a preliminary report that we have, an interim report for 2013, which actually we have even better news as well. I want to thank the leadership of the mayor. I think it has been of paramount importance. I also want to thank Walter for the monitoring, but I also want to thank all the community health centers, all the primary care providers, all our partners. As we move right now in terms of the healthcare system, a lot of what the public health departments in the nation have been doing is going to be transferred to the community health partners, clinics, primary care providers, and that's part of the Affordable Care Act. So some of the funding that historically we had is going to be transferred to the communities. And that's going to be a challenge for a lot of these processes that we have in place, but that we have to start working on it since yesterday. And that's one of the things that I want to thank Michael Carfen publicly, because we have been working with our HRSA partners, with our CDC partners, with our HHS partner, even housing partner, in terms of how we move and transition from the system that we have today to the system that is coming to us very soon. I also want to acknowledge all the great work that the people from HASTA has been doing at the department. They work day and night. They take this really at a personal level. And I think that when you look at the grades, I want to give A+ to the mayor. I want to give A+ to Michael. I want to give A+ to HASTA because of the work that they have been doing. And I also want to give A+ to Don and people like him that has been really champions related to the HIV. And more than HIV, because HIV right now is a chronic disease as well. And so they have been able to create this ecosystem to support the patients that are living with HIV. I think that instead of concentrating on new slogans, what we have to concentrate is all the accomplishments and learn from them, and also learn from the challenges that we had in the past and move forward. Good thing is that we did a study in the agency, and it shows that all the marketing tools that we had been using have been effective by the people actually that were surveyed, so that was excellent news for us. So with that, I want to thank Walter and Appleseed for the support in terms of giving essentially a picture of what's happening in the HIV community in terms of, which is the healthcare community in general, working together. So with that, I would prefer that Michael continue with some of the numbers that the mayor already had mentioned. I just want to wish you a happy Hanukkah, Merry Christmas, and happy holidays to all of you. Thanks.
Well, good morning. Thank you, Mr. Mayor. Thank you, Dr. Garcia, for your leadership. All of this would really not have been possible without the vision that you bring to trying to change the epidemic here in the district. And I want to thank DC Appleseed, Hogan Lovells, Washington AIDS Partnership, and the entire team in the effort that has been with also the input from our community partners into this process. I was mentioning, Paola, you spend 6-7 months working on this, and here we are this morning to release this and then start all over again. But with that, I really want to acknowledge that over the years, and this is my 8th of 9 report cards with working with DC Appleseed, that this effort really does raise the bar, and it raises our expectations to excel. And even though we may not reach A's in every single category, and there may be some ups and downs from year to year, it really does motivate us to do better for our community. And one of those better efforts is to try to get data out to help our community be able to fine-tune and may be flexible with the types of programs that they're doing to be more effective in the response to the epidemic. And for the first time, we're releasing actually an interim report on HIV in the district. This was a recommendation from DC Appleseed in its last report card. And as I said to Walter, I do what he says we should be doing. And so one of our efforts is really to try to get data, more current data available on a more frequent basis. And this is our first effort in that. And I'm pleased to report, as the mayor gave some of those statistics, that and I want to caution that this is preliminary, and preliminary means that when we release our complete report in 2015, that the numbers might change a bit, but the trend is certainly, it continues to be encouraging as we're reporting preliminary for 2013, 497 new cases of HIV. That's down from 680 in 2012. And as the mayor said, nearly 60% since 2008. So we continue to make progress, and that's really the effort of our community working with us at HOSTA and our other governmental partners to make this possible. So thank you. And we'll have copies of the report, and it'll be posted on our website as well.
So thanks, Michael. Thanks, Mr. Mayor. Thanks, Dr. Garcia. What I want to do now is just take a minute to focus on some of the highlights of the report card. As the mayor said, it is long. It's an attempt to be thorough. I hope some of you will read it. Our intent with this report card always is to be fair and objective, and as Michael said, where appropriate, to provide incentives, and where appropriate, to raise the bar. And I hope that is what we've done. I just want to mention how great it is that we're getting more data. I remember when we wrote the initial report in August of '05 and in the first report card, one of our strongest recommendations and concerns was there's no way to assess where you are when you don't have data. Data not only measure where you are, but they point to where you should be going, what you should be doing. And that's the key use of the data. And I know that is what the team here in the district government is doing, and I know it's what the community partners are doing. And I just like to underscore one more time what everyone has said, but it's critical to remember this. Addressing HIV/AIDS is a citywide issue. It takes all of us working together. It isn't just the district government. It's the community partners, it's the foundation community, it's the business community, and it's actually the people living with HIV and AIDS. It takes everyone working together to address this. Let me just say quickly a few great things about what is going on, and then I want to focus on the two areas where we've given grades that I hope will soon be higher. Some of the work that Washington, D.C. is now doing is not just cutting edge, but it's a model for the nation. I think what the city is now doing, and you can see it, I hope the report card is big enough for you to see in the back of the room, what the city is doing on condoms and testing and surveillance and partnerships and at the D.C. jail is really great stuff. And it's important to applaud that, to give credit where credit is due, but in the next breath you have to say, it's got to be done. This good stuff has got to be done in all of these categories if we're going to get a grip on this epidemic and do what all three of the gentlemen have said, and that is end the epidemic. So I applaud the city for that. I applaud the city for the new data. I applaud the city for the fact that the areas where in nearly every area where we were most critical last time, Mr. Mayor, we have raised the grades. Not all of them, but in nearly all of them, we have raised the grades. And again, I want to think the incentive helped do that, but more importantly, the commitment of this team to get a grip on this epidemic is very much in play. And I know there's a whole lot of people standing beside you. The three of you are the leaders of this effort, but there's a whole lot of people in the district government and the community been working very hard on this issue for a very long time. I'd also like to now talk about two areas for just a minute. And the mayor mentioned one of them, and I'm going to mention the second one. The most important one for us, and Kavitha Cardoza has talked about this and reported about this for some time and has come to the report cards. In our view, and you can read about this in the report, if you only want to read this section, pages 22 to 27, in our view, we are still not doing what the mayor mentioned that we need to be doing, and that is taking better care of the education of our public school students on this issue. It's easy for me to say that. It's a very difficult thing to accomplish, but we have specified some things that we think need to be focused on more to make that happen. And the proof that that needs to happen is the data show us that we have rising STDs for young people, and the category, and we point this out in the report, the category where the numbers are not going down. Most categories, yes, but the area where new infections are not going down is in the 13 to 19 age group, which demonstrates how critical it is that we do everything we can to make sure that we educate the kids in the classrooms and we test to see how much of the data they are getting. And this is where we think it's not happening at the level that it should be. And specifically, one of the things we have pointed out is that when the Healthy Schools Act was passed in 2010, OSSI was directed to adopt regulations to implement the requirements of that act. OSSI has a role to play both in DCPS and in the charter schools to make sure that, in fact, the education that is required for the kids and the testing to make sure they're getting the education they need is, in fact, happening. Now, regulations alone don't achieve things, but they are a good first step to signaling where the focus is and what OSSI intends to enforce and implement in the schools. Now, we are told that the regulations are going to, at least the draft of them, are coming out next April 2015. Better late than never. We're glad to see it. We hope that our continued concern about this is going to help make this happen. It is critical that we have data that show that we're actually producing the results we need for the kids. And right now, the proof is in the pudding that that is not going on. We're particularly concerned, and we say this more than once in the report, that not only do we not see the oversight that we think is important here, but the data that are being released are not school-specific. We have broad data that say, as a general category, how the students are performing on the tests that show how much they know. But we don't have school-specific data. And as I think we've all agreed, the more specific data you have about where the problem actually is, the more you're apt to focus your attention on adding resources and concentration to where the problem is. So I hope that next year, when these regulations come out, we're going to see that OSSI expects to release school-specific data both in DCPS and in the charter schools. We've also made the point that we think, at least based on our analysis and our investigation and our interviews, that the charter schools are still not doing all they need to be doing. All you have to do is compare what they're doing with what DCPS is doing to show that there is significant room for improvement. And we believe there's a role for individual charter schools to be doing better and for the charter school board itself to be doing better. I understand there's an autonomy issue here. I understand that charter schools are charter schools in part because they want to have the flexibility to call their own shots. I appreciate that. But the Healthy Schools Act passed by this council and signed by the mayor applies to the charter schools as equally as it does to DCPS. And this is an area where more can and should be done, and it's where we're going to be focusing our monitoring going forward, and I hope that many of you will be doing that as well. Let me mention the other area where we're giving a C+. If you glance at the report card, it's not hard to find where the C's are. There are more A's than C's. Congratulations. But the other area, and in some ways this is a tougher nut to crack, because affordable housing is an issue that I know this mayor cares about, that this council cares about, that the leadership at HOST and DOH care about. But more has to be done on this issue, particularly with regard to one of the most vulnerable populations, and that is low-income people who are people with HIV and AIDS. And the numbers are just not good there. And as federal funding decreases to support this housing, it simply means that the city is going to have to step up the pace if, in fact, we're going to be providing the housing that people with HIV and AIDS are entitled to have. And the numbers of people on the waiting list, as we point out on the report card, are growing. You know, in some ways, the change between '08 and now and '09 and now is great by many measures. But with regard to affordable housing, it's going the other direction. And I believe that part of what's going to have to happen is that the city is going to have to commit more funds to this. To their great credit, Hosta and Michael Carfin, and we described this in the report, pages 39 to 41, are engaged in a lot of creative efforts to address this issue. But so far, it's not enough. And at the end of the day, what matters is results. And the reason we're giving a C+ here is there's a lot of effort, but so far not sufficient payoff to get it done. One of the things we do in the report that I just want to mention here is, because this is Mayor Gray's last report card, and you know, Dr. Garcia said he would give the mayor an A+, and I think that's probably right. This mayor has been in this fight from the beginning. He's been visible, he's been supportive, and even though we haven't always given an A in leadership, that's because there are other elements for which the mayor is ultimately responsible. But the mayor personally has been committed here. And I hope and believe, just as Mayor Williams, just as Mayor Fenty, just as Mayor Gray have been working closely with us and community partners on this issue, that Mayor Bowser will be in the same camp. Leadership at the top in the city on this issue is critical to getting the results that we all want. And we've been presumptuous enough in this report card, as we did when you started, Mr. Mayor. We have our top 5 priorities that we have suggested for Mayor Bowser. They're on pages 5 to 6 of this report. They're easy to say, they're hard to do, but we think they're all very important. The first is to make HIV/AIDS a top priority of the administration, which is something I believe Mayor Gray did. Another is to engage the entire city in addressing the epidemic. A third is to focus more on youth education for the reasons I've already mentioned. A fourth is to get better data. And when you get that better data, report to the community how you're going to use that data to address the epidemic. And finally, housing. So those are our top 5. I'm hoping and thinking, if the same people who've been working with us up to now continue to work with us, not only can we make those 5 a top priority for this city, but we can do what all 3 of these gentlemen said and move toward the day when we end HIV/AIDS. And on that note, I want to mention one other thing, and then I'll stop. We have been asked by the Washington AIDS Partnership, who actually came to us originally in 2003 and first asked us to get engaged in this project. They have come to us again and said that it is time to work with the community and the district government and the funders to develop a plan for this city to end HIV/AIDS. Those of you who follow this issue, and most of you in this room do, know that in San Francisco and in New York and other places, they are now developing such plans. I think this city is now at a point when we're ready to develop such a plan. We're going to all need to agree on the elements of the plan, and then we're going to need to agree on an action plan to get it done. But I believe now is the moment to move all of this to a higher level. And one of the reasons why I say that is because of the numbers that Michael just reported. It is great good news that the preliminary data for 2013 show that we have only 500 new infections. On the other hand, it is devastating that at this late date in the epidemic, notwithstanding all of the good work of so many people, that we still have 500 new infections. More has to be done on prevention, treatment, care, housing, everything that we are grading in this report card and more. And I believe that if all of the partners work together on this issue, not only can we develop a plan to end HIV/AIDS, but we can actually accomplish it. And so we at DC Appleseed look forward to working with all of you and many who are not in this room because they couldn't take the subway this morning. I'm grateful to all of the support and cooperation that others have shown to us as we've tried to be a useful, constructive monitor of where we are and where we need to be. So that's all I have to say. It could be that someone will have questions for some of these gentlemen. Kavitha, if that's what you want to do. What?
I have a feeling of deja vu again, Walter. This is the third year I've been coming to these, and for all 3 years for schools, and I cover schools, we are at a C. In fact, our grade, if you look at us 10 years ago or worse, we were B-. We've gone down. Yeah. And last year I asked you what you would say if the draft report didn't come out, and you said no, they have promised to release it. Can you comment on that? And also, how are you giving the mayor an A+ if that is the case?
Well, we're not giving the mayor an A+. I would give the mayor an A+ for his commitment. The leadership grade is a B, in part because of what we see as the failure to make progress on this issue. And I think a lot of it is at OSSI's door. I think a lot of it is at the door of the charter school board. I think a lot of it is at the door of the individual schools. And, you know, we're leading the horse to water, and I'm hoping that in the coming year the horse is going to start to drink. But I agree with you. This is something, and we've, in this report card, used some of the strongest language we ever have on this issue. And I'm hoping and thinking we're now going to see some movement. As I said a minute ago, we're supposed to see regulations to move this ball forward in April. I hope that's the case. I don't know if any of you want to comment further on this, Mr. Mayor?
Well, I can comment on the charter school issue.
Could you stand the other mic, please? Thank you.
On the OSSI issue, there is a commitment to get the regulations done, and that will happen. I'm certain of that. However, the charter school issue, and Walter put his finger on it, and that is charter schools fundamentally are autonomous. That's the way they're structured. And the issue, I think, is, and this is where we need to go one step further, what are the levers that will compel individual LEAs? Because each charter school is its own local education agency. I mean, I think we have, I don't know, 55 or 60 LEAs that are charters now, each one autonomous. They're not structurally responsible to the Public Charter School Board. They're not structurally responsible, obviously, to the District of Columbia government. So what has to be done is to determine what the levers are that will compel the charter schools to be able to respond to this, because I don't see where they are at this stage. Maybe the media need to step up the game in saying that this is something that the charters have not complied with as fully as we would like and we need, and more needs to be done. Because right now, what I could do as mayor with the DC public schools is very different than what I can do with the charter schools.
But Mayor, you know, when it comes to reporting, kind of making sure kids are in safe buildings, making sure we hold charter schools accountable for test scores, I mean, in every other domain, because the district government funds public charter schools, there is a level over there.
So when it comes to HIV/AIDS, why do we throw our hands up in the air and say, "Oh, they're autonomous; they can do whatever they want"?
I don't think we're throwing our hands up in the air, but I think if you go back and look at the law, you know, I can't just stand up and say, well, cut off the funding because you haven't done as much as we think you should do you know, on the HIV/AIDS issue. I don't think we have that authority. You know, perhaps we can ask our Office of the Attorney General to take a look at this and see what additional authority we have to intervene. I don't think there's any disagreement on my part, and I'm assuming on the part of Dr. Garcia and Michael Carphin, there is no disagreement about the importance of doing this. What we've got to find now is the entree that says, if you don't do this, this will happen. And I don't see that at this stage.
Have you personally had conversations with the head of the charter school board to see?
Yeah, I meet with the head of the public charter school board every month.
About this issue?
Not about this issue, of course, but yes, we've had a conversation about this, and none of us has answers at this stage. The public charter school board obviously charters these schools, but in terms of how the schools run themselves, if they conform fundamentally to how, you know, the basis for the charter being issued in the first place, there is no entree for them even to do anything. So I think this is a challenge. That's why I raised it again. You raised it as an issue. I raised it as an even more specific issue in terms of finding the pathway to be able to get the charters to do differently than what they've done up to now. You know, there is, I've got a meeting with a charter school later today in which we, in an unprecedented way, intervened into the operation of a charter school more broadly. This is IDEA. And we put them on probation. And it may be that the mayor can exercise that authority in the future as well. That was quite unusual for a mayor to intervene in the operation of a charter school in that way, because there are those who would argue that that is fundamentally contrary to, you know, why charters exist in the first place. You know, it is worth a more thorough discussion, because on the one hand, I think the autonomy has served a number of our kids well, but I don't think it serves people well to be at a, you know, public health risk on an issue like this. And speaking of education, I am heading off to the federal court because we are hopefully presenting our last report today on the Jones part of Blackman-Jones. And if we're fortunate, that order will be vacated, which means that it will be the first time in decades that the city hasn't had supervision of our education system by the courts. So hopefully that'll go well. Maybe I'll mention this issue to the judge as well.
So I think we're done. Thank you, everyone, for coming. The work continues.